You think you know how to suture, but I can assure you, you are missing two key things. The first, I'm going to cover in this tutorial. The second, we cover in our live sessions. You need to get personalized feedback. Go to medsyncltd.com/events to join our live, interactive, off YouTube platform for live suturing training where you get personalized feedback on your techniques. Let's get into this live. So the second thing you need is economy of movement. I'm going to teach you how to handle your instruments in a way that will allow you to be fast but precise. Let's start with the entry point. Ring finger, thumb, middle finger on the angle, index finger extended. Don't pinch, just reflect. Rotate at 90 degrees, push through. Grab the needle at the body, not the point, put it through. Now watch this. Forceps go into your palm. Needle stays in the needle holder so that you can grab the thread along its length with your left hand with the forceps in it. With the same hand, pull the suture through. What you're not gonna do is this. Well, what you're not gonna do is put this down and pull like this. This is a waste of time. You're gonna keep your forceps in your web space and just pull the suture with your one hand until you have a short end. Push the suture forward, make a loop, wrap it around just the tip. Not this big movement, just around the tip. Pull it tight till you see epidermis touch epidermis. You don't need to pull it any tighter. From that position, you're just gonna go here, makes the loop around the tip and tie, around the tip and tie. Well, this is where the real magic happens. You pull the long suture up, you put the needle holder into that same left hand. Your left hand now has your needle secure here, your needle holder here, your short suture is ready to cut, your forceps is ready to go for your next stitch. You pick up your scissor, you cut for yourself, and then you palm your instrument. You carry on suturing. This is now your position. These are the tips you need to look like a pro in theatre. This is when somebody asks you to stitch. These are the techniques you use to give them the confidence that you can do the basic things well. This will allow them to get you to progress onto the more complex skills. As I mentioned, I'm going to repeat the skill again. Pay attention. As I mentioned, these are the essential skills you need to look and be confident, palm the forceps, but the real key is to get some personalized feedback. You can join our live sessions, which are on Zoom, so we can see what you're doing. If you want some feedback, go to MedSync. Just look at me pull this suture up. Forceps is here. Bring everything into your left hand. You can cut the short end. We're going to do a continuous suture. If you want to join our live sessions, go to medsync, sync.ltd. That's not true. medsyncltd.com/event. The link will be in the description. So now we're going to do a continuous stitch. Another common stitch you'll get asked to do in theatre when they don't know you. Suturing is the first task people will get you to do to test your skill. This is a quick suture. How do you make it quick? You invert your skin, you go through straight away. Don't grab the tip, grab the body. I'm going to zoom in so you can really see this in more detail. This is how we do our live sessions. Off platform, you can join them. Invert, go through, grab the body, pull it through, mount it straight away. You're ready to carry on suturing. Join our live sessions off platform to get some personalized feedback with me and any of the other surgeons from the team. medsyncltd.com/event. We've got one on December the 7th. It's an hour-long session. You get all these extra tips that took me maybe 10 years in my career to learn and package into these small sessions. 1, 2, tie your knot. Now my knot's become loose because I've got a very short end. So here's what I'm gonna do. I'm gonna tension it by pulling on just the short one. When I'm happy, pull the long one. Although they're both the same size now. Can I do it? Yes, I can. Put everything into one hand, ready to go. See that? Forceps are still here, needles in my hand, scissors are ready to go. No time wasted. Now, this is the next thing that they'll use to assess whether you are safe in theatre. You need to secure your needle because there's nothing left. Turn the point towards the needle handle. I'll show you that again. So rather than passing it back to your scrub nurse or anyone else unsecured to cut their finger, you turn the point back into the body and lock it. Nobody can hurt themselves. This is sharp safety. So we're covering some quick tips this Sunday before the start of the week for many on how to look like a pro when you go to theatre. You get asked to suture because they want to see what you can do. You're starting a new placement, you're starting a new job, you've been asked to come and assist in theatre. They say, can you close? You say yes. This is what we're gonna do. Thumb, ring, middle finger on the angle, index finger extended. If you've got the morning tremors because you've been drinking lots of coffee to wake up, or maybe just got a shaky hand, keep your forearms planted on the surface, keep your elbows tucked in against your body, don't have them up in the air. And you start like this. Enter at 90 degrees, don't keep it flat. You want to get a good excursion just through the top 2 layers. Don't go into the fat if you're just stitching skin. Equal distance on both sides, push through. This is the pro tip. Mount it straight away. Palm your forceps, don't put them down. Pinch, rotate, pull the suture through, leave a short end. This is how you look experienced. Wrap 1, 2. Don't leave the long end really long. Keep it nice and short, no more than 2 centimeters. You tie, and again, you tie, and again. If you are assisting a surgeon in theatre, here is the unspoken language. If they put 2 sutures up together, you cut both. If they put 1 suture down, 1 suture up, you cut the one that's up. If you can't see the suture on the top of the skin and it's inside, you cut above the knot, but flush with the skin. Flush with the skin means on the level of the skin, not the skin itself. How do you cut with scissors and look like a pro? Just like you would normally in terms of mounting the scissor. However, you open the scissor, you slide down the suture, and you cut with just the tip, not down here, not really like bold and big like this. It's precise. You open, not at its full width, slide down, you change your angle, and then you cut. Easy. It's how you look like a pro. Skin glue is good. However, it only works if your edges are already together. If they're not, you need to suture it. Some people choose to staple, often in orthopedics, but that's another topic for another day. Okay, last time. 1, 2. Palm your forceps. And you tie. The best ways to get the training you need is to get some personalized feedback. Do a couple more and show you how to stitch fast. Is to join a live training session. We do those off platform. Go to medsyncltd.com/event. You can join our next session. We do 1 a month. It's free for YouTube members. And give you a coupon code and palm. And that's a quick session on economy of movement, precision, and how to impress when you first go to theatre. On that note, good night and join our lives.